27th degree with Chris and Nancy from 27 Degrees Consulting. Today, we're really excited to have Dr. Demetri Rizos with us. And Dr. Rizos is a nephrologist and a hospitalist. And he's had quite a lot of experience with COVID, and we're going to continue our COVID-themed podcast. Last week, we had a great podcast talking about the vaccine. Dr. Rizos spent quite a bit of time in New York working with COVID patients, and we're going to talk a bit about that today and his experience. So why don't we start a little bit by just talking about your background? Maybe you can tell us a little bit about yourself.
Well, thank you for having me here today. This is a bit of a homecoming for me, actually. I was actually born in Fall River. I was raised in Lowell. They asked me to leave because I'm not Portuguese. But raised in Lowell, had the good fortune to go to medical school with the Navy, trained with the Navy. My wife, who was a Navy nurse, returned to New England 13 years ago. I've had the good fortune to work as a nephrologist and a hospitalist over the past 13 years, and I just recently came back to Fall River.
That's great. Actually, I didn't know you were from Fall River originally. That I am also, actually. I was born and raised in Fall River, so that's interesting.
Yep.
So, great.
Let me say one more thing before we start. I had the opportunity to go to dinner with Joe Rogan last night, and he has seen your ratings, and he's getting very nervous. No.
I wish we were a threat to Joe Rogan, but that being the case.
Hey, we're getting there. It's like little baby steps, right?
That's right.
Maybe after this podcast, this one might really bring us over.
My launches on.
So tell us a little bit about your experience.
Right. So 2020 for me and my family personally didn't get off to a good start at all. My dad was in a traumatic car accident in February. It was very unexpected. He was hospitalized. He was flown from the North Shore into Boston, where he was put on life support for 6 days. And after numerous conversations with different surgeons, we opted to let him go. And that was on March the 2nd.
I'm sorry.
And, consequent to that, my family and I were very, very emotionally depressed, angry, upset. I think every emotion that you can have. And then during that same time frame was when the pandemic really began. And towards the end of March, at that time, I was called from an old friend of mine who was working in the Bronx in New York. And he said, things are getting rather hairy here in the Bronx, and if you can spare a couple of weeks, we'd love to have you here helping us. So I had a long conversation with my mom and my wife, and my mom was actually very upset when I told her that I'm thinking about leaving and going to the Bronx. My mom said, look, we just lost your dad. Why would you want to put yourself in that situation? And I said, well, if this was affecting the North Shore in Massachusetts the way it is the Bronx, I would hope other people would come and help me, So, to be candid, I kind of felt that my dad wanted me to go to help out. And so I went. I went thinking that I would go for 3 weeks. It turned into 3 months. The Bronx is a borough that's very, very tight knit, both physically and emotionally. The Bronx is a very, very tight community. They were hit exceptionally hard. Multiple families with multiple family members were either ill or hospitalized or critically ill. And this tiny hospital where they had me in the Bronx had nurses and physicians from all over the country who came to volunteer. And we didn't know each other that well. We had to make friends quickly. We had to assimilate, and we had to work very hard. They had me running a PACU, a recovery room that was turned into an ICU. The hospital already had 2 ICUs. They had a medical ICU and a surgical ICU, but they needed to have a third ICU given the number of individuals who were in respiratory failure. So we were working 12-hour shifts, 6 days a week. Every morning we had a meeting with both the Comfort, which was the Navy hospital ship, and also with the Javits Center, which was a center near downtown Manhattan, which was a makeshift a field hospital that patients were sent to as well. So it was kind of like a chessboard figuring out which patients were going to be assigned to which location. The mayor had asked our hospital to be receptive to all patients, COVID or non-COVID. And if somebody became ill who was at the field hospital, then they came to us. If we had somebody who was improving, they went to the field hospital. So there was a lot of conversations back and forth about who was going where and when.
Demetri, can I stop you for a minute? Because, excuse me, not because I need your medical expertise, but you said an awful lot. So I just want to break down a few things. And I apologize. I was drinking tea and I swallowed wrong. But you had just lost your dad. So you just went through a major loss in your life. And then you're going into New York, which at that time was a battleground hotspot, to deal with super sick people with this contagion that no one knew what was going on. I mean, that's incredible. Just that. And how did you deal with that mentally?
Well,
right. Going into that situation.
So my dad was a priest, Orthodox, and my dad was the first one to help those in need, whether it be emotionally or whether it be in any fashion, whether it be through confession or whatnot. And I really feel that I really got the sense that he wanted me to go. I just had that connection, and this was a decision that I didn't that took a lot of thought and effort. And my wife is a nurse, and my wife and I were both in the Navy. At one time, we were active duty Navy, and both of us were deployed in the past. And I said to her, I said, look, I think that being in medicine, having the privilege to help other people, this is the time to do it. This is the time to go in a situation where people desperately needed help, physically and emotionally. Families were not able to come to the hospital. Many of our patients from the Bronx they were Hispanic, and there was oftentimes a barrier with the language, and we had interpreters and social workers, and we really, given the fact that we had many people from all over the country who didn't know each other, who had to assimilate quickly, who had to work as a team. I think that what was done in the Bronx by this hospital was remarkable, and I think that, given the fact that I added my little bit of knowledge and skill set, really meant a lot to me personally, because I know that if my dad was alive, I think in his way, I think he would have given back as well.
And he would have been super proud of you, for sure. How out of your wheelhouse was that? Like, when you're like the first time you walk into that situation, what are you feeling?
I really haven't been nervous. Yeah, I really haven't been nervous as a physician since residency. Residency, you're learning, you're getting your feet wet, you're beginning to be more independent, more autonomous, and given the fact that I was in I don't want to say the word combat environment, but it was much like a disaster scene. It was much like a disaster scene where we had patients who were overflowing. They were in the halls. We didn't have the ventilators that equaled the patients who we had. We commonly had to make a decision if we hadn't had a patient who was elderly and not doing well. We had to make a decision whether or not we felt that we should allocate our resources on this patient towards somebody else. And that was these are conversations which I've never had before with family members who could not come to the hospital. One story, we had a gentleman, a son, who adamantly wanted to see his father. His father was in his late 80s, early 90s, on a ventilator, and was very, very ill. And we told him many times that, unfortunately, you cannot come and see your dad. We can have you see him by video. And what he did is something which I don't advocate, but he actually came to the hospital with a scrub top and bottom, and he told security that he was working in the hospital with maintenance, and he somehow managed to come to the ICU, and next thing we know, there was a gentleman at bedside, and we asked him who he was, and he said to us he was the son of the patient. And he said, I wanted to be here to talk to my dad. Now, the way that he did it maybe wasn't the best, but his heart was in the right place. Nobody faulted him. Nobody called security. Nobody asked him to leave. He spent the last couple of hours with his father. And it was a very touching moment. It was very overwhelming for the whole staff.
What was the hardest part for you in the context of frustrating that maybe we've worked out? I mean, we're in a predicament now that numbers have risen through the roof again. Arizona, I think, is the number one hot spot in the world right now.
Yeah.
So what are the parallels to where the time that you were there to what we're seeing now with those numbers and the conditions?
I think that the resources that we have now, obviously the vaccine.
Yeah, sure.
But I think that the resources that we have now, we didn't. Number one, the resources. Two is the fund of knowledge. I think that one thing that I regret that we underestimated was that these patients who were infected were exceptionally hypercoagulable, which means that they really have a tendency to have blood clots, both in the legs and the lungs. And that's something that we didn't really have respect in the spring as we do now. And we had young individuals in their 40s, healthy individuals, non-diabetic, who were infected, who died of blood clots. And we were very, very surprised by this. We simply didn't have that association that we have now. So I think that the numbers may be the same right now, maybe a bit higher than what they were in the spring. But I think that both our fund of knowledge and our resources are much better now than what they were back in April of last year.
With the situation that you were in back in New York, and tell me, you were saying that you originally had the idea that you were going to be there for 3 months, 3 weeks.
Right.
How did that stretch to 3 months?
I didn't want to leave. I felt as if that I felt as if the process was such that getting your credentials took a little bit, and I felt as if that me leaving would have left a bit of a hole. And I'm certainly not saying that with ego, but right. I think that to have somebody already there who knew the system, who knew the colleagues, to have somebody brand new come would have been very challenging for them. So I stayed, and they had me living originally in the Bronx by the stadium, by Yankee Stadium. And baseball is my passion, and to be living half a mile from the stadium, and the streets were empty. April and May, there was nobody on the streets at all. It was just surreal. Mm-hmm. Because I've been to ball games in New York, and the Bronx is the epicenter for baseball, and to be in the Bronx and to be by the stadium and to have nobody walking around. In fact, going to work one morning, the radio station I had on, the young lady said, well, good morning, everybody. It's Tuesday or maybe Wednesday or Thursday. We're not sure what it is really, but have a good day and be safe. And that was the atmosphere April and May. People were scared. People were working hard, and I think people asked me if I was nervous, and we didn't have time to be nervous. we just worked as hard as we could. We did our best to keep people alive. We did our best to have patients leave the hospital, go to rehab, to ultimately be back with their family members, and that's all we wanted to do. We just wanted people to go back to their lives and have some semblance of a healthy life, and that's all we wanted to do.
Dr.
Demetri,
Rizos,
I was going to ask Demetri, while you were there, did you struggle with not having enough equipment, PPE, and all of that? We hear stories about how it was in New York at that time. What was that like for you there? Did you have everything you needed or not?
Not at first. What FEMA did for the hospital, both in terms of finances and in terms of equipment, was overwhelming. We had, certainly many hospitals were looking for supplies. There were certain hospitals that were targeted by FEMA that were designated as COVID hospitals, which we were, and FEMA really did a great job of giving us the supplies. I think by the end of April, beginning of May, we felt much more comfortable in terms of having PPE, in terms of having ventilators. We ourselves felt much safer by the end of April, early May than we did when I started. Despite the fact that, when I left in June, family members were still not able to come to the hospital. We felt as if that we were given the resources that we needed to have, so that way family members could ultimately be united with their family at home. And I think in terms of networking with the Navy that was in town, networking with other centers both in the Bronx and in Manhattan as well, we felt as if that we did a pretty good job overall. But FEMA really was the backbone. FEMA really gave us the resources that we needed to have towards the end.
Doctor, I was going to ask you before, so you're in that type of situation, and you manage and you do such a good job with the limited resources that you have, with not knowing what you're dealing with just being at the start of this whole process. Like, what were you really proud of? Like, what things went really well? And did you adopt any of those processes, or did you bring anything that worked really well back home with you to implement moving forward?
I think that anybody who works in healthcare, they're going to have good days and they're going to have bad days. And being in the Bronx, I felt that my worst day working back home was absolutely nothing in comparison to what I saw in the Bronx.
Sure.
I was humbled to be part of a team of individuals that really came together, that really wanted to help those who are in need. And I think that it doesn't matter what you do in healthcare, whether you work on the patient side, admin side of the house. If you have the opportunity to go the extra mile to help someone who is in need, that's what it's all about. And I felt it was a privilege to be in a community that's exceptionally tight knit. That's a very, very loving community. That the Bronx has a ethnic history. It has a very workman-like atmosphere coming from the Bronx, and these families have a lot of pride. and to be able to help out these individuals. And there were some elderly individuals in their late 70s, early 80s who we saved, and we felt very happy with that. It gave us everybody when those individuals came off of the ventilators, when they left the hospital, we felt very happy, very satisfied with that fact.
I'm going to ask you something. Again, you were in the unique position that you went into that situation already having a certain level of stress. I think stress was one thing that defined 2020. Like, people really had to find different coping mechanisms and dig kind of deep. Can you share with us a little bit on how you handled all the stress that you were under?
Well, listen, I'm Joe Smo. I'm no,
You're very humble.
I'm not a superhero by any means. Just ask my wife; she'll remind you of that every day. But I myself, given my condition in March after I lost my dad, I needed to be productive. I needed to be at work. I felt as if working would help me to kind of come back to being me. And I feel very fortunate that I was put in a situation where I got to work as a team member and not as an individual. And I think being part of a team, being part of something much, much bigger than myself, made me feel good about myself. And that made a difference personally for me during those 3 months, most especially during April and May, especially.
Oh, sure.
Demetri, thinking back now, I mean, you must have forged some amazing relationships down there, I'm sure, probably some that will be lifelong for you. How did this change the way you look at medicine now, or the way you practice, or the way you function at this point, going through an experience like that? How did it change others that were in that experience?
It's funny you ask that, because many of us, towards the end of the stay, towards the end of June, many of us felt that, as I said earlier, even on our worst days at work, we would be happy, because our worst days at work would be nothing like what we had in New York. So if I have a bad day at work, if I feel as if that things aren't being accomplished, if I feel as if phone calls aren't being addressed, or if information is not being obtained in a quick manner, that doesn't bother me like it did in the past. Little things don't bother me now, and I certainly don't. I really hate to make that analogy, but once you've been in a situation, whether you've been in a COVID environment, whether you've had an opportunity to be deployed in the military, I think that first of all, I think that you're much more humble. I think that you're much more respectful. And I also think that you appreciate little things much more. I think that little things that may bother you in terms of your day-to-day work responsibilities, and in terms of things that need to be done, I think that things like that don't bother me as much, because we saw things in New York where we really had to stop, and we had to really just take a deep breath, and we really we relied upon colleagues who we didn't know all that well, and we put our skill sets all together. We helped each other. We this was much bigger than any one of us individually. And I think that working as a team, working with a bunch of physicians and nurses, technicians, etc., I think that when you have a common cause, working with the sickest of the sick, when you do that, everything else that may have bothered you in the past no longer does so.
Doctor, how would you address the creep of complacency, I guess, that people have with COVID now? They've kind of gotten used to things a little bit, and maybe they've heard, oh, if you get it, it's not going to be as bad as it was early on.
Yeah.
As a doctor, like clinically, what would you say to someone who's kind of like, I'll be okay?
Yeah. I think that mentality may be a little naive. I think that everybody needs to understand that this is a marathon. This is not a sprint. And any precautions that you take from now, whether it be getting vaccinated, whether it be wearing a mask, isolating 6 feet apart, maybe not going to Florida, maybe maybe waiting do it next year, do it 9 months from now. Every little thing that you can do from now will not only help yourself, but also help not just your family, but also your community. And I think that little things really matter. I think that during the holiday season, a lot of people, got complacent. Maybe that happened because they were frustrated, because they wanted to go to a party, because they wanted to be with a crowd, with a work gathering, etc. I think that each of us really needs to take a deep breath and really ask ourselves, what can I do not only for myself, but also for my community? I think this is the time not to be selfish. This is the time to think about the others that you live with in your community. And I think that having a vaccine is wonderful. I hope that the supply will be augmented very soon. But if you have when, not if, but when you have the opportunity to be vaccinated, please do so. And also, please wear a mask. Wash your hands. Try to refrain from being in congregating in groups, large groups. Please refrain from going on vacation until maybe 9 months from now, 12 months from now. Everything that you do from now will pay off for not just yourself, but also for others as well.
Yeah, I think you brought up a lot is the theme of community and doing things that are selfless. And there's still a lot of folks out there who won't wear masks because they feel it's my right not to wear a mask, or they don't want to get vaccinated because they read something on the internet from a questionable source that gives them pause. But it's great to hear your story and hear your point of view, because I think it's something that we're really lacking in this society. When we talk about what's going on right now with COVID, what we're missing is that we're all part of a community. And yes, you certainly have a right to wear a mask or not wear a mask, I guess, but you're harming others in the community. So we have to look beyond ourselves, and we have to look at, how do we get out of this as a country? How do we get out of this as a community? And the only way we do it is exactly what you've mentioned. We wear masks, we socially distance, we don't travel, we don't go to parties, and we get vaccinated. I'm really amazed at how many people I run into who have decided that they don't want to get vaccinated. And it's troubling because I don't think we'll get over this as a society unless we all, a majority of us do. We really have to. And it's great to hear your point of view, and to hear that your focus on community basically, and selflessness, because I think that's what this has to be about for us to get out of this.
I think that the internet, I think, is a wonderful thing. I think, unfortunately, there is a great amount of misinformation on the internet when it comes to vaccines.
Correct.
And I know that this has been a battle that pediatricians especially have had to deal with over the past 20 years or so. If you have the opportunity to not only protect yourself, but also your loved ones, I think it's a no-brainer. I think, unfortunately, there are situations where some people, unfortunately, do have a bad reaction towards a vaccine, any vaccine.
Yeah.
I think that isn't new information. I think that's been happening ever since the very, very first vaccine was created. But I think that the benefits of a vaccine, especially this vaccine, the benefits far supersede any negatives. And I think that people are concerned that the process whereby this vaccine was created was rushed. But please don't. That certainly doesn't imply that shortcuts were taken. I think that the FDA did a very, very good job overseeing the manufacturing of the vaccine. I think we now have 2, if not 3 vaccines available for COVID. I think that the FDA was on top of this from day one. I think that hopefully in the next weeks and months, I think that that more vaccines will be available to the public, and I hope that the public takes advantage of that.
I hope so. There's a lot of I'm not sure how to really say this. A lot of rationalization that goes on with COVID. So, whenever someone dies of COVID, the first question is, or the first thought is, well, they were older, or they had a comorbidity, or that. But you've seen, and I've seen too, but you've seen people who are young and healthy who get real sick from this, and sometimes die from this. So it's not only people who have lots of comorbidities. Anyone can really die from this disease, and it's like playing Russian roulette not to use a therapy like a vaccine, which is so effective. But like you said, even if you don't want to do it for yourself, do it for your loved ones.
Yeah, I think if you want to gamble, call your bookie. I would not gamble on COVID. It's just a lose-lose situation.
Right.
If you're young, you can still get very sick. And as you know, we have many young individuals who have been a little cavalier,
right?
Who have they feel as if they're infallible. And this is a vaccine. This is a virus that doesn't care how old you are, what your race is, what your ethnicity is. This vaccine, this virus doesn't care. This virus doesn't care how much money you have. So if you have when you have the opportunity
Yeah.
to be vaccinated, please do so.
Yeah, I mean, a lot of times, I think when people rationalize, it's a form of self-protection to, you know, validate why they're not really scared or why they're not going to get the vaccine. But the reality is that this virus can injure and kill anyone, and every life is valuable. So to say that, well, they were older, they were a nursing home population, or they were had these other health issues, that in itself is very disturbing. As a society, we should really have the same concern for everyone, whether they be aged, older people in a nursing home, comorbidities, whatever it may be. We should be trying to protect everyone, really. And it's, to me, it seems so poor to say, well, they were older or they had this going on. We should care about everyone as a society.
Yeah.
And part of that is trying to protect them. And a big part of that is going to be the vaccine. So I think I'm probably repeating myself, but I'm just urging everyone to get it. I got it a couple weeks ago. It was fine. I had no problems. We just vaccinated our nursing home. We gave out yesterday hundreds and hundreds of vaccines. We really had no major serious issues. We had one person who had a vasovagal event, which can happen with any vaccine, where they got a little lightheaded and that was it. But everyone did fine. I think the stuff that's out there on the internet is just a lot of it is crazy, and it's not even really based on any science or reality. So I would say, if you're really concerned and you want to really know what's going on with this vaccine and how it's produced, go to the CDC, go to a legitimate site. But
the government sites are great too, mass.gov/COVID.
Yeah.
And they actually even have a pretty comprehensive timeline now on when certain people are eligible to get the vaccine. So that was one of my questions for you, Chris. Like, I think I'm pretty sure April is open for vaccines for the general public.
Mm-hmm.
So how will they get those? Are you gonna be providing those to your patients with office visits?
It won't be in our office. It will be for Prima Care. It looks like it's going to be centrally. So I don't think we're going to be giving it at the office itself. So it'll probably be at the infusion center or something of that nature. I'm more to follow on that. We don't really have an exact idea of how this is going to be given out. But what I am told is that if it's given at Prima Care, will be given centrally. And I think a lot of groups will probably do that. A lot of pharmacies will be giving it out. There's talk about having mass vaccination at Foxborough Stadium, et cetera. So,
right. But they've kind of set up in Arizona.
Yeah. So, I mean, I think this is probably going to be done a number of ways. We had one of the pharmacies come down to our nursing home. We have 270 residents and a lot of staff, and they did a fabulous job. They were there one day, and they got really everyone who wanted to be vaccinated. So, there is the opportunity to really be efficient and give a lot of vaccine out once we have it available.
I'm certainly not a therapist, but I think, given everything that's happened in the country in the past 10 months, 11 months, I think a lot of people are not only scared, but they're angry for many, many different reasons. And consequently, people will become depressed or anxious. And if you feel as if that your depression or anxiety, or your spouse's anxiety or depression has come to a point where they need help, please speak to your physician, your provider, and please, there are individuals who will readily talk with you, either on the phone, either by video, in the office. I think that this is, I hope that in 2021, I hope that this is a subject which is no longer taboo. Mental health is as important, if not more so important, as your physical health. You may be a weightlifter. You may be a pro athlete who may be in tip-top shape, but if emotionally, if you feel as if that you're suffering, if you feel as if you need to talk with somebody, please do so, especially now.
Yeah, that's a great point. In my primary care practice, I am amazed at how much anxiety and depression, how much more anxiety and depression. It's always been a big part of primary care, but the amount of patients coming in now that are just having severe difficulty is incredible. It really is. And that's probably the tip of the iceberg, because I think you're right, Demetri. I think a lot of people probably don't come in and they sit and suffer in silence, and that's concerning. And one of the things we don't want to see from all this stress is, people taking their lives, or the lives of others, or issues such as that.
I think if you have the luxury, if you have the time to volunteer,
Mm-hmm.
if you have the time to work at a food pantry, if you have time to help other people, I think that's wonderful, because I think that you may not realize it, but I think that you may also help yourself in the process.
Yeah, I think so too.
Yeah, that's a great point.
Over the years, I've done some volunteer work, and Nancy, you've done some volunteer work, I think, and I think you get more out of it than you put in. You go into this with a sense of what you're going to do, and at the end of the day, when it's all done, you probably take more out of it than you may give in the long run. Now, you just get a lot out of this type of activity, and now where so many people feel they don't have a purpose in life, this is a great time to be able to pitch in and help out.
It's certainly no fun for anybody when you look into the abyss.
Right.
and that's not a place that you want to be. And I think that commonly, when you help others, you're very, very commonly helping yourself as well. But having said that, if you feel as if that you're going the wrong way emotionally, please take a moment, pick up the phone, call a friend, family member, call a provider, and please get the help that you not only need, but you deserve.
Yeah. And if you're out there in that situation, you're not alone. So
No.
A lot of time there's a sense of isolation when people are depressed, but you're not alone. I think our society is really, we all know that we're really suffering right now, and there's a lot of people out there that are in the same boat. So don't be afraid to pick up the phone and call. There are lots of people out there that can help you. Family, friends, professionals. No one wants to see someone really have a bad end.
Yeah, I was going to say, we had talked a little bit about doing a podcast next month with a mental health specialist, and kind of tackling a lot of these subjects and letting people know ways they can connect to get help. I think we should definitely button that up and button that down.
Yeah, I think that.
Yeah. I think that this may sound rather sexist, but I think that the men really are apprehensive to open up. I think that the women, the wives, are much more apt to pick up the phone, call a provider. I think men tend to bottle things inside, and this is probably not the best time to do that, because when you keep on bottling, you're just going to get more sick.
Yeah, I agree 100% with that. Sure, absolutely.
So, Doctor, just going back to your efforts in New York and where you are right now, it's, again, thank you so much. It's incredible what you accomplished in New York. Where do we've certainly seen the whole transition from COVID during the early beginnings of 2020 to now. What do you project, knowing everything that you do and the timeline and the things that you've done? what are you looking at 2021? Like, how do you think this all will unfold? I'm asking you to look into your crystal ball, Demetri.
Right. Well, I think that the key, I think that the elephant in the room is the vaccine. And I think that the more individuals who get vaccinated, that's really the key. And I think that hopefully 12 months, 18 months from now, things will be much more normal, quote unquote. Unfortunately, if you look through history, every 100 years or so, something of this magnitude does happen. Whether it be the plague, whether it be the influenza, there's always something every 110 years or so. And now, we have the good fortune now in this day and age to have resources that were simply not available 100 years ago, even 30 years ago. I hope that people will use common sense, both for their own health and also for their families, and also for the health of their neighbors and their community as well. I think that, God willing, I think that people will be acceptant to be vaccinated. People will tone down their gatherings, their vacations, etc. And I think that God willing, 12 months from now, I think that we'll all be safer.
Mm-hmm.
Can I ask you both, as physicians, the timeline was wicked quick to get the vaccines out and the research that was done and all the clinical trials. Is this going to change medicine moving forward? Are we going to see things happening quicker now?
I mean, I think this came out really, first of all, it came out quickly, but it was well vetted. So if anyone is out there and is listening and is concerned that the vaccine was not really put through the normal paces as any other vaccine would be, they should not feel that way. Be reassured that this was studied well. I think it went through the approval process quicker because we were in the situation we were in. I would think that other vaccines down the road, when we're not in such an urgent situation, are going to take longer to come out to the public. It's just this was something that we needed to do to save lives. But that being the case, it was still vetted well, and the studies were solid, and no corners were really cut. It was just more the I'd say red tape, legislative, bureaucratic.
Like the hyper focus.
It went quicker. The study part was, that was the same as with any vaccine. It was solid. I think, being a vaccine that we have, a type of vaccine that we haven't used before, I think it may open the doors to other vaccines, other mRNA type vaccines. So I think we may find that this type of technology is used for other diseases. I think there's going to be a lot of good that comes out of the research that went into making this vaccine as time goes on. Once again, I think that we get through this by doing all the things that Dr. Rizos mentioned, and vaccination is a big part of it. If you still have concerns about the vaccine, go to a legitimate source and read about it. Go to the CDC, see what they have to say about it. Stay away from the dark fringes of the internet where there's questionable information. There's a lot of questionable information out there that's not based in any science. So, just be intelligent about it. Look at it, look at where the source is coming from that you're referring to. And there's a lot of good education out there about these vaccines, a lot of good knowledge. And there's a lot of bad stuff out there too. And the bad stuff is what's going to prevent people from maybe getting it. And that's going to hurt our whole society. And once again, we have to look at this. What do we have to do that's best, not only for ourselves, not only for our families, but for our community, for our society, for our country, for the world? Vaccination is a big part of it. And if you have hesitation or reservations, just make sure that you really research this, because I think a lot of those reservations will go away if you really look at legitimate information.
Yeah, I think that every visit that you have with a provider, I think just take a moment and say, hey, based upon my age, which vaccines am I a candidate to receive? I think a ounce of prevention, as they say, is worth a pound of cure.
Right.
And I think it doesn't matter if you're 25 or 75. I think that you always have an opportunity to vaccinate and to prevent. It's much, I think as a physician, if I have an opportunity to either nip something in the bud or prevent it entirely, that makes my day. I would much rather give a vaccine than give an antibiotic.
Right.
Absolutely.
That's a great point. That's perfectly said. All right. Any last thoughts or any last messages you want to get out there, Dr. Rizos?
Listen, I think that this service, this podcast which you guys have, is wonderful. I hope that your audience gets bigger and bigger, and I hope that they continue to seek information from you.
Thank you so much for being a guest. Yeah. It was great having you.
Thank you.
My pleasure.
Yeah, this was really great. It was really educational and I think informative for our viewers. So thank you very much. Thank you for what you do. Thank you for volunteering so much of your experience and your life and your time to help COVID patients. And thank you for coming here to talk to us about it today. It's really greatly appreciated.
My pleasure. Thank you.
Next podcast, we'll try to get a mental health worker to talk about some of the effects that COVID has had and just the stress in society in general has had on mental health. And we'll talk about some resources that are out there for people who are suffering. So once again, thank you, everyone. This is Chris and Nancy with Dr. Demetri Rizos from 27 Degrees, on the 27th Degree, and is brought to you by 27 Degrees Consulting. And we'll see you again in a couple of weeks.
Bye.